So to come, cutting-edge technology and breakthrough research. Up next, experts joining us live to highlight a game-changing tool in the fight against cancer. May is National Cancer Research Month, and this morning we're focusing on a remarkable leap forward in medical diagnostics, nuclear medicine PET scans. They're not new, but they are pivotal now more than ever in assessing and combating cancer. Joining me today to shed light on the topic is UC Davis nuclear medicine professor Dr. Ramsey Badawi. Thank you so much for being with us. I know a lot of people wondering exactly what is nuclear medicine?
Well, thank you very much. Yes, nuclear medicine is a very interesting technique. We use it to basically, in the cancer context, we can use it to find the cancer, and we can also use nuclear medicine therapies to actually go in and treat the cancer.
How does it differ from other medical imaging procedures?
Yeah, it's very interesting that. So in nuclear medicine, what happens is we take a really tiny amount of a radioactive material, could be like a radioactive sugar, and we inject that into the patient. And it goes where sugar would go, and it turns out that cancer takes up an awful lot of sugar. So then the cancer kind of lights up, and then we put the patient through, say, a PET scanner, which has a ring of detectors, which can then figure out where the sugar is in the body, and therefore, in this case, it would actually see where the cancer is.
So I hear you saying injecting something radioactive, immediately I go, oh, that can't be good. So tell us about the risks, how they compare perhaps to other diagnostic procedures.
Yeah, that's a really good point. The amount of radioactive material we use for a nuclear medicine scan is really tiny amount. You can ingest that much radioactive material and suffer no ill consequences at all, effectively. The amount of risk you get is very similar to what you get, say, in an X-ray CAT scan, something like that.
So what sort of diseases or conditions are most commonly diagnosed with nuclear medicine techniques?
So the most common one is cancer, but we can also use it in heart disease, in Alzheimer's disease, and some other diseases, some kinds of kidney diseases as well.
How widespread is this treatment? Because I know for many people in our audience, perhaps this is their first time hearing about it. How widespread is it?
So most big hospitals will have a nuclear medicine department, and there are many PET scanners all around the country and other nuclear medicine devices as well. The images that you're seeing at the moment, these are called total body PET scanners. That's a fairly new technology, so that's not as commonly available, but we're seeing it going in some of the major hospitals now. For example, some of the children's hospitals are starting to pick up on it.
And so a patient having this, how should they prepare for this type of scan, and what should they expect during the procedure?
Well, the nuclear medicine physicians and technologists will tell you what to do ahead of time. If you're having a cancer scan, that will typically involve withholding from food for 4 to 6 hours before the scan. It's really quite important. You don't want to mess with the sugar metabolism in the body, so the body needs to be in a fasted state before you have the scan. And then you go into the scan, you'll go and have an injection, you'll then sit in an uptake room for about an hour or so before going into the scan. The scan's very quiet, it's not like an MRI scanner, and you'll be in the scanner with a typical scanner about 20 minutes or so, but with a total body PET scanner like the one behind me, it may be much quicker than that. For children, we can do it in just a couple of minutes.
I can imagine that nuclear medical scans has really been a game changer in influencing treatment decisions. Tell us a little bit about that.
Yeah, so regular scans can typically tell you like what the body looks like on the inside, which is tremendously helpful, but a nuclear medicine scan can tell you what the body's actually doing. So that can tell you the difference between a benign lump and an actual cancer. And it can also help predict whether a cancer is likely to respond to a particular kind of therapy. So that's hugely helpful for making sure that the patient's care is optimal.
Dr. Ramsey Badawi, thank you so much for shedding light on this new treatment, or perhaps new to some people, treatment that they've not heard of before. How can folks learn more from you or about this new procedure?
So a lot of information available on the web. If you Google nuclear medicine with the hospital that you're likely to be working with, you'll find lots of information on that. My own email address is available on our websites. If you Google up University of California, the Explorer Project, you'll be able to get access, and we can tell you more.
Well, thank you for your time this morning. I know it's an early start out there in California, but we appreciate your time this morning, Dr. Badawi.
Thank you. You're my pleasure.